Hi, everyone. Welcome. My name is Marilyn Shannon. We have a little oops before, but we'll oops our way back in. And I hope you're all having a wonderful day. I'm so excited today. My daughter's due date is tomorrow, and it's her first child, my second grandchild. And I said to her this morning, Dara, you're still going to work. Where's your clothes? She said, it's at home. And then I thought to myself, Grandma, where are your clothes? They're in the car. I go nowhere without my clothes, just in case I get that phone call from her that says, Mom, it's time. So it's very, very exciting. And there was one other thing I wanted to share with you, a little trivia, that today is our 157th show. And I'm so excited. That's a really 3 years we've been working on these shows. So that's real exciting. So thank you all for being with us today and sharing this wonderful week and this wonderful day. And good morning to you, or good afternoon, Amnon.
Good afternoon. Sorry.
Oh, you're really engrossed.
And those of you that, if you didn't get sound, you should have sound now.
Okay, perfect. So we're really excited for today's show, as I am each and every week. We have a very lovely woman on our show today who's been on the show before. So we're happy to invite her back because this is a topic, Lyme disease, that when we had Dr. Spreen on the last time, people were like, it was just blowing up the lines. And there were questions asked afterwards. In fact, I had a woman contact me weeks later to ask me when Dr. Spreen would be back on. So please, if you know anybody in this moment that is being impacted by Lyme disease, any tick-borne diseases, call them up on the phone. Get them to watch and listen to this show because it's really impactful. So get out all your friends, post it on Facebook, put it on Google+, send it out on Twitter, because a chance like this, you don't get that often. So Dr. Spreen is a physician, and she is interested in educating professionals, patients, caretakers about the potential risk posted by tick-borne diseases. Her goal is to provide both information and support for all those impacted by these complex diseases, and they are. And from the last show that Dr. Spreen was on, I was educated just ever so slightly, and it really is pitiful, and it really is amazing, the information that patients are receiving, that caretakers are receiving, and how it affects people is just amazing. And so I am really delighted to once again welcome Dr. Kathy Spreen to our show. Kathy, good morning or good afternoon. How are you?
Good afternoon. I'm very happy to be back.
Well, thank you so much for sharing your time with us today. It's really important. So the last time we generalized and we talked some about tick-borne diseases. So I'm going to ask you to go into some of that again, and then I know we want to talk some about our kids and playgrounds and things like that, but go ahead and just for people who have not tuned in before, just give us an overview of what you've done and why you've done it and what you've accomplished and what it is, all of that stuff.
Well, about 5 years ago, my son got so sick from tick-borne diseases that I didn't think he was going to survive. Now, I'm an old emergency room doctor, and I thought I had seen it all. But he was so sick that we couldn't rouse him, and none of the doctors who initially saw him had any idea of what to do to help him. So I spent the last 5 years gathering information, doing preceptorships with physicians who just see tick-borne illnesses, and sorting through thousands and thousands of articles to put everything together into one resource, which is the book that I wrote, which is called Compendium of Tick-Borne Disease, 1,000 Pearls. Now, this book covers a variety of topics. It wasn't as though there wasn't enough information out there. There was probably too much information, but it was very contradictory and confusing and complicated. So I sorted all through that, and now I have a resource that both healthcare providers and patients can use to get the information that they need to manage these very complicated cases. So now that school is about to start again, I think it's important to educate people in terms of the fact that the playground outside of school can be a haven for ticks, and that people need to be careful. So I'd like to just educate people in terms of what they need to do to keep children safe in the schoolyard, on field trips, in the playground, at day camps, those kinds of things, to make sure that other families don't have to go through what we went through when my son first got sick.
So when we're talking about playgrounds that are under trees, away from trees, does it matter? What?
Well, schoolyards are especially risky because ticks don't like the manicured yards that we keep in the suburbs. They like to go up against the long grass that's next to the playgrounds, and that's where kids like to run and play. That's where balls often fly into, and kids go in there to retrieve them. At that point, the child can get a tick on them and not even realize it, and it can attach and bite them, and then transmit disease. So that's why we like to educate people, because you think you're safe in school. You think that nothing bad can happen to you there, but it's often a very risky place, as are field trips, because field trips are often to places where the children aren't necessarily familiar with the background, and they go off running into grass and running around trees and things. Ticks are often in places where trees had been cut down, a forest had been removed to build houses or to build schoolyards or to expand a playground or expand fields where kids play soccer and a great variety of sports. So now that kids are back practicing fall sports, you have to be aware of all those situations where tick exposure can happen.
Wow, I'm not the same again as when before you came the first time, because now whenever I go anywhere, I'm having my husband just check me over. I mean, I've really literally been conscious of this, so I'm happy to bring this out because it's important. I was never that conscious of it before. So what do you tell parents about these areas and checking their children, or the school system? I mean, what are we doing with the school systems?
Well, I have a large section in the book about school nurses, and I think school nurses are very important in terms of educating both parents and children, keeping them informed and being vigilant about ticks, knowing how to remove a tick, knowing products that can be used to deter ticks. There are products out there that contain a product called permethrin that you can spray on clothing, on socks, things like that will kill ticks that come into contact with that. Also, products that contain DEET, which is a tick deterrent, can be used to keep ticks off of children. Those are all important, and those have been determined to be safe to children, for children, even very young children. So those are things that are important. I like kids to check for ticks often. There is a myth that the tick has to be attached for 24 hours before it can transmit Lyme disease, and that's not the case. We have many, many anecdotes and confirmed cases of Lyme disease where the tick wasn't attached for 24 hours. I know in the case of my son, that tick could not have been on him for more than 8 hours. We know that other co-infections that are transmitted by ticks can be transmitted in very short order. So you have to be very vigilant, especially the younger the child, the thinner their skin, the softer their skin. So the tick can get a good bite on a child in a very soft area and transmit disease in short order. So that's something that school nurses need to be aware of, parents need to be aware of, and kids need to be aware that they need to be looking for ticks. I like to have people check about every 2 or 3 hours. Just run your hand up and down in areas that could be exposed to ticks, It's important to check areas that aren't just visible. Ticks do go up pant legs. They do go around the waist. They can attach just about anywhere. So you have to be very vigilant. Look at the hairline, look in the scalp, look in behind the ears. Ticks can surprise us. And because the small ticks, the deer ticks that do bite most frequently and transmit Lyme disease are very tiny, you have to be especially vigilant because they can be as small as the period at the end of a sentence, as small as a tiny sesame seed. So always be vigilant. In your area, there's also the Lone Star tick in southeastern parts of the U.S. They have a kind of a white splotch on their back. People think it looks like a star. Those ticks are a bit more aggressive. They will come at you as opposed to the deer tick, which often just sort of hangs out on grasses and things and leaves. So you have to be, it's not just the deer tick that can be exposing people to diseases. Other ticks as well can be harmful.
So I want to ask you a question. You mentioned touching the child, which I think, sounds logical and sounds right, but I am sure that opens up a world.
Oh yes, I meant the child to be touching themselves, running their hands up and down their skin, looking for that little tiny little poppy seed of a bump, because sometimes the tick is so small that you don't even recognize it as being a tick. So no, I did not mean to imply that either the teacher or the nurse should be running their hands over the child. No, the child or the parent can do those kinds of tick checks.
And what about the younger? What about the younger? I mean, I'm fine with it. But what about the younger kids? That must be, you have kids in nursery schools, but I guess a lot of them are playing on concrete, playground areas or gravelly kind, soft playground areas. Ticks are not there, right?
Well, ticks don't like hot surfaces. They won't go across like hot asphalt because they dry out and die. But they are around the edges. And with that being said, ticks have been found everywhere. They've been found in the Sahara Desert. They've been found in Antarctica. So this winter, when ticks aren't supposed to be active, when it's below freezing, well, where my son lives in Indiana at Purdue, it went down to 40 below degrees Fahrenheit. When it warmed up a few days later, people saw active ticks on horses. So you can never be too vigilant. You always have to be aware. So if children can be educated to look for the little black bumps that might be a tick, and then to show their teacher or their parent or the school nurse, and then that person needs to know how to appropriately remove a tick. Now, I must get a call every week with all kinds of rather bizarre ways to remove ticks. Now, a lot of these things work, but let me explain to you why they may not be a good idea. Yes, if you use nail polish or acetone or dishwashing liquid or Karo syrup or a lit match, yes, the tick will usually back out of the attachment area and can be removed. But the reason that that's not a good idea is because as that tick backs out, the tick is irritated, agitated. If you light it on fire, it's going to be very upset. So not only do you have the tick saliva contacting the skin, but the tick also regurgitates or vomits its stomach content. And that stomach content also contains pathogen. So now you have both tick saliva and tick regurgitation in contact potentially with the skin and the blood supply of that person, because the tick was there trying to suck blood out of the person. So if those pathogens get into the skin, then disease can spread. So the best way to remove a tick is to take a fine point tweezer. I like slightly curved ones. Put it down near the attachment site, press down slightly, and then pull back, slow and steady. You don't want to be too aggressive. You don't want to jerk, because then the head can detach from the body. So you want to be slow and steady, pull directly back out. That's your best bet. Then you want to wash the area with a little soap and water. And usually, because the tick has barbed pieces in its mouthpiece, a tiny little piece of skin, of your skin, will come out with that tick when you pull it out. That's not bad. That's good. If there's a little bit of blood there, that's fine too, because hopefully the pathogens, the bacteria that cause the diseases, are coming out with it, not going in. So you wash it with a little bit of soap and water. You can put a little dab of antibiotic ointment on it if you like, and then just watch. I do recommend that people do save the tick, although many healthcare providers don't know what to do with it. Once you save it, you can save it in a jar. You can save it in a little piece of cellophane tape. Just tape over it so it can't escape. And then some people like to have the tick tested. Now, commercial labs are often quite expensive, and there can be quite a delay in getting the results. There are new testing available now that there's a company called Affiniton that makes a product called the Limalyzer, and it's a little kit that has the antigen from 3 different species of the Borrelia bacteria that causes Lyme disease. You can put up to 5 different ticks in this little kit, and you'll have your answer on whether or not that tick contains one of those 5 species within about 5 minutes. Now, that does not diagnose Lyme disease, but what it does do is it shows that the tick that bit you may have those pathogens in it, did have those pathogens in it, and that you may be at higher risk of getting the disease.
Kathy, let me ask you.
Sure.
So how long, and Chris is asking this question, how long do you need to keep the tick?
Well, you can essentially keep a tick for extended periods. It's not going to necessarily deteriorate. You can keep it for quite a while and then give it to, put it in this Affiniton instant tick testing kit, or send it for testing, or just keep it in case anybody asks. Most healthcare providers that I've encountered just didn't have any idea what to do with the tick. Now, I know in Pennsylvania, Delaware, and Maryland, we're getting a little more legislative action in terms of some funding for task forces that will do more tick testing and education through this. But if you know that the tick that bit you does have one of these species in it, it may inspire the healthcare provider to be a little more aggressive in treating the condition or the potential condition before the person gets so sick that it's harder to reverse the symptoms.
So, Kathy, do you notice certain ways that, let's say, children respond different? Do children respond differently to a tick fight than an adult, or is it pretty much the same?
Well, children may be more at risk in terms of their skin is thinner. So the tick may be able to get a good chomp into that child and get into the little capillaries and things. Whereas if it was bitten on the thicker skin of an adult, it may not be quite as much risk. But as I said, you always have to have a very high index of suspicion for anyone. Now, it doesn't seem to matter as much if it's an adult or a child that's bitten as it does that individual in terms of how they might react to the Lyme disease bacteria. Now, probably about half the people who are determined to have Lyme disease get treated or not treated with a short-term antibiotic, and they're never bothered by it again. But maybe 30 to 40% of the people do have ongoing persistent symptoms that can last for quite a while. And even a smaller population of that, maybe 5 or 10%, are totally debilitated by the disease for an extended period. Now, what makes one person get it and not really be bothered by it over time versus the others that are really affected by it? Well, studies out of Johns Hopkins and Stanford, several months ago now, have come out measuring the different kinds of white cells, comparing those people who have persistent problems versus those who do not. And they found out that these two populations are different. So there is probably some kind of genetic predisposition that makes some people get sicker than other people or persistently sick. It could also have to do with the strain of the bacteria that bit you. It can have something to do with whether or not you have other infections with it. We know that people that have Lyme disease, which is caused by a bacteria called Borrelia, if they also have Babesia, which causes a type of North American malaria, both of those organisms affect the immune system, and the immune system affects them. So people can get sicker. It can be harder to diagnose because it gets more complicated. You can't tell what's what and how what's causing which, and if it's more than one thing. In your area, you have other diseases as well, things like Bartonella, Ehrlichia, Anaplasma, Mycoplasma. There are all kinds of diseases that can be transmitted by ticks, and you have to try and find healthcare providers that understand this and don't just dismiss people and not pay attention to the symptoms that they're having.
So let me just interrupt you.
Sure.
And if anybody is out there and you would like to call in and comment, ask a question, have a need, please do that. We really want you to. This is really a good opportunity. If you've got something on your mind and it has something to do with Lyme disease, tick-borne diseases, please call, or protect your children, whatever. 919-518-9773. And if you'd like to connect with us via Skype, you're more than welcome to. And that would be computers, that's plural, the number 2, K voice. You will come in on Skype voice. We really would love to hear from you, and this is a really great opportunity. Dr. Spreen is an expert. And she's not just an expert, as you can tell, of like book learning. She has expanded it into many, many realms, and It's really important. And she, it's understandable. You got an opportunity here. She's not just talking jargon. Dr. Spreen, first of all, how is your son doing?
Well, he's doing better. He's still on treatment. He's in another course of treatment, which will take about 15 months of aggressive antibiotic and other modalities to try and get everything settled down. But he has a very complicated case. He does have clear immune markers that show that he has what's called an autoimmune response to tick-borne illnesses. So he has Borrelia, which is Lyme disease. He has Bartonella. He has Babesia, and he has Ehrlichia. So he has quite a complicated case. He does have several good physicians that are working together to help him out. But the key factor with him is that you have to have physicians that recognize that people can be sick with more than one tick-borne disease at a time, and that it can take a long time to treat these symptoms. Now, there's a lot of controversy. Sorry if you hear my clock chiming in the background here. There's a lot of controversy about how to diagnose and treat Lyme disease. The International Lyme and Associated Diseases Society has just come out with a new set of approved guidelines on how to treat it. As I read those, it seems like they're very much in line with the options that I have provided in my book. So it's I'm glad of that. But there are a lot of people who don't think that Lyme is a very serious disease and don't think that you needed to be treated for longer than 10 days or 30 days for the condition. But that doesn't seem to be true for this significant subpopulation of people that really have ongoing significant problems.
You mentioned.
Go ahead.
You mentioned, and I'm sitting here and I'm thinking, okay, she has so much to say, and I am supposed to be interviewing her, but why should I interrupt this? I mean, really, I don't want to, but there are things that are popping up for me that I wanted to check in with you. First of all, what kind of response are you getting, or is the medical community getting from the school systems? Are you getting response? Are they showing up at conferences? Are they learning about Lyme disease? Are they supporting your work?
Well, different school systems have different approaches. There was a educational course in Cambridge, Maryland, a few months ago, and there were quite a few school nurses there, and I was very much heartened by their enthusiasm. In Harford County, Maryland, there has been a lot of support by their public health group there as well. But there are other areas where it is much more difficult to impact the school system. And that's where the school nurse can become so important. She can serve as the bridge between the administration and the patient or the student and their families, and explain to them that it's not a simple disease in some of these cases. Sometimes the children need special accommodations. They might need to be homeschooled for a while. There might need to be longer test times. They may need to have different times to enter the school or come to school activities. Sometimes administrators get very upset because a child will be too sick to come to school on a certain day, but then they'll see that child outside looking like they're playing. And that's part of the difficulty with this disease. It can come and go. It can flare and remit in very short order. Sometimes people are bedridden for weeks. Other times they're bedridden for a day or two, and then they have a little rally only to crash again. One thing that I would recommend to school people, one of the important things about schooling is the socialization. And kids that are homeschooled because they're too sick to come in often feel very isolated and very lonely. And there the teachers and the nurses can explain, after a day or two being homesick, it's not fun anymore. It's boring and lonely. And that socialization and interaction with other children can be very important. So if the school would be flexible enough to allow those children to have some interaction, because it's difficult for a kid to never be able to meet up with the other students. If they just would allow the child perhaps to come in and meet with other kids for a chess club meeting or something like that. It's also important to know that you're not going to get sick from these kids. You can touch them, and you can, other students can touch them or brush up against them, and they're not going to get Lyme disease from being near these children. So there is all kinds of ways that flexible accommodations can be made. And if everybody works together, the administration, the school nurse, the parents, it's possible that these kids can be accommodated within the school system so that their education doesn't have to be interrupted. Now, I know a number of people that had to skip a year of school, be held back for a year of school because of Lyme disease. That happened to Miss Delaware. She's now back at the University of Delaware. So that is resolving well. The MVP of the Women's Basketball League, also from Delaware, Elena Del Don, had to miss a lot of time from both of her college basketball games and professional games due to Lyme disease. But if you learn to kind of work around the disease, people then can come back and participate again.
I was just thinking when you were talking about the schools and accommodations. I mean, so you're saying that this falls under like becomes a special ed issue and an IEP issue. And I had not ever seen, I taught special ed for a little while, and I don't recall ever seeing, obviously, tick-borne diseases as a category, but there was the other health issues, OHI, I think they called it, that was a category. So this, I guess, would fall under that. And when you're homeschooled, you are entitled to come into school for art, for gym class, for all of those things. So I would hope that parents are taking advantage of those when they can, and if they know that they can.
Some schools are much more flexible on how they interpret that than others, because some people will say, oh, well, if you can come in for art, you can come in for history. And so there's been controversy, as in many of the aspects of tick-borne illnesses, with accommodating these kids. But there's a huge section in the book that talks about the individual plans for kids and how the different agents in this discussion can work together, and how compromises might need to be made, and just ways to help integrate these kids back into the system. And I think it does help the students to know that the school is supportive. Sometimes a kid just needs to know that they can go to the nurse's office and lay down for an hour, until they kind of get past uh, their time when they're just debilitated, and be able to interact again or go back to the classroom. So all these kids are going to have different ways that they respond. They may do well for a couple of weeks and then crash again. I know that in my son's case, in the last time when he got so sick, he was so fatigued that he could not walk across the room. So it was very difficult for him to even get up and get dressed and go into the classroom. So, but sometimes, in his case, he had special funding. He was doing his qualifying exams, and these were one-shot deals, and he didn't have an opportunity to do any of these things again. So had he not continued, he would have lost his funding, lost his spot, and couldn't have gone on for his PhD at that point. So that was a very, very difficult time. He couldn't concentrate for more than 5 or 10 minutes at a time. And this was a kid who, before he got sick, could study 20 hours a day, 7 days a week. So this was something where he had to refocus, study for 5 minutes, rest for 5 minutes, study for 5 minutes, rest for 5 minutes. So fortunately, that testing is now behind him, and his professor is very receptive and very accommodating, because she has a child that has a chronic illness, and it's not Lyme disease or tick-borne illness, but she understands that sometimes accommodations need to be made. And if people are putting forth the effort, then perhaps a little flexibility can help everybody out.
Well, I'm so glad you chose to come from this perspective, from this standpoint, for this particular show, Kathy, because this is so important. I mean, even just so obvious that how thin. I'm thinking of my grandson. He's 2.5. I mean, his skin is so thin. I never had given that much thought, as far as Lyme disease and the playground. I'm really sitting here and I'm visualizing all these things, and this is so important. And for parents to really understand, just as you said about the school system, well, parents really have to understand too, because when you see your child up and down, it's really, sometimes it is hard to know that they really are, not feeling well. And how bad do you have to feel to really not be feeling well? So, this is a really important talk.
Well, there is I know in Maryland, there is an educator, her name is Dr. Nancy Fox, who is putting together a curriculum for elementary school kids, teaching them about ticks and tick-borne illnesses. And one of the things that she does is she takes an orange or a little clementine or whatever and sticks cloves in it, and has the children practice taking out the tick with the little curved fine point tweezers, so that and the kids like doing that, and they're interested in that part of it. And she's also written a children's book that can be accessed if you just put in her name, Nancy Fox, and that teaches children about ticks and tick-borne illnesses, which can be very useful for an individual child to share with their classmates if they are sick from a tick-borne disease.
Right. I just want to tell everybody, we'll put together show notes after the show, and we'll have them up on the MarilynShannon.com website. So some of the information that you might not be getting because you're listening so intently, we'll have up there some of this information, and you always can go back and listen, watch this show again, because this is like this is like an encyclopedia. What we're experiencing today is a living encyclopedia, and you will want to share this for sure. So please just check our YouTube channel, Marilyn Shannon YouTube channel, and you'll see it there as well as on our website. So that's very important. I want to ask you something about autoimmune.
Mm-hmm.
So are people that have autoimmune susceptible to, when they do get a tick bite, or if they do get a tick bite, to having it be more drastic?
Well, we're just beginning to learn about autoimmunity. I mean, certainly we've known some things about autoimmunity for a number of years, but the amount of information that we're having is still limited. We know that people like my son do have markers on some of his white cells that suggest that he will get sicker from Lyme disease, probably due to an autoimmune response, than other people might. And we do understand that there are things called, there's a syndrome called PANDAS, which is a pediatric autoimmune disorder that's associated with strep infection. But they also think it can be associated with Lyme disease infection and probably some of the other diseases like Bartonella and Mycoplasma. We just don't know enough yet. But autoimmunity means that your body gets mixed up. Bacteria and human cells share a lot of genes, and the body can get mixed up, and it can think it's fighting a bacteria when it's actually fighting itself. So this is the case in a lot of diseases such as lupus. Lupus is an autoimmune type disease, and the body is fighting against itself. So that seems to be the case in at least some patients who get Lyme disease. And when your body is fighting itself, you're going to be feeling pretty miserable, because you're always going to be in a state of inflammation. You're always going to be in a state where some of the powerful chemicals in your immune system that are used to destroy bacteria are actually now targeting your cells and destroying some of your cells. So that's something that people like my son are now facing, even though we don't know enough. Perhaps I'm hoping in 10, 20 years we know enough so that people don't have to suffer quite as much as they're doing so now. But we do need more research, more funding, and more understanding in the medical community before we're going to make more progress.
Right, just like we do in mental illness.
Absolutely.
You know, Chris has two things that on here that I want to ask you about. First of all, she is saving ticks that she found on her daughter. She's got, and Amnon just asked me to share, she's got it in alcohol. Is that okay?
Well, I prefer to just save them in cellophane or in a jar, or you can put them in, you can get one of these instant tick testing kits, and you can save them until you have a couple if you like. They're actually relatively inexpensive compared to if you sent them to a commercial lab, or if you sometimes government agencies like the agricultural extension services will test them, but there's often a very long delay before they can get to those, because in many states like New Jersey, they used to test them and then funding was cut. So now they have lots of ticks stacked up that haven't been tested. So these, the Lymealyzer tick testing kit, I think you get 2 in a packet, and you can check 5 ticks at a time, and I think it's about $10 per kit, $10 per test.
Mm-hmm.
So you get 2 at a time. So those are something you might want to check out. There's no special need to keep them in alcohol as long as you just keep them contained.
And then what about how long can Lyme or any tick-borne disease stay dormant in somebody before it flares up?
Well, that's the million-dollar question. We know that in my son, his last big tick bite was at least 5 years ago. 6 months ago, he was starting to have symptoms again. We did a blood culture on him, and ticks were everywhere. Not ticks, the Lyme bacteria, the Borrelia, were everywhere. So we know that this organism can have different life forms. One of the life forms is a spirochete, a little curly-Q kind of bacteria. They get into the bloodstream, and when the spirochete is floating around, that's when you have the symptoms. But those spirochetes can also go into the tissues. They can get into the joints, into the heart, into the kidneys, into the brain cells, nerve cells, skin, joints. Anywhere a blood cell can go, they can go. So what happens there is they can then go dormant. They can stay dormant for years. In probably all kinds of patients, but especially in these patients that have these flares. Now, they can also form cysts. These aren't necessarily the kind of bumps that you see under your skin, but cysts that are kind of capsules that protect the bacteria from antibiotics or from good white blood cells that are coming after them. They can also form things called biofilms. Biofilms, again, are a protective coating around these bacteria that protect them from both antibiotics and from good white cells. And they can stay in these protective cysts or protective niches or biofilms for extended periods. We know in diseases like shingles, that comes from the chickenpox virus. Everybody who has chickenpox has the chickenpox virus in them forever. And if you become debilitated, you can get shingles or other things from that virus. Some people never get it, and some people do. But just like that, the bacteria that causes Lyme can be dormant or inactive for long periods of time, or protected in cysts or biofilms for long periods of time, only to resurface either when you're feeling poorly and they think the coast is clear, they'll resurge and come back out and you'll get symptoms again.
Wow.
So
that's an interesting, well, that's really interesting, because if you take a look, you wonder, if I take a look, I wonder, like now with people having so many different types of illnesses and things, you just wonder, you know, how long ago they might have been bitten as a kid.
Oh, my son's big flare that happened 5 years ago, his antibody pattern suggested that he had been infected before. We probably just thought it was a flu syndrome, or, you know, it kind of came and went, or he was treated with a little antibiotic and it kind of went okay. But that there was still residual there from previous tick bites. So we just don't know enough about these diseases now to draw solid conclusions. That's why I always encourage people to be very, very vigilant. Don't let healthcare providers who don't understand the diseases talk you out of what you know is true for you. If you're sick, them telling you that you don't have Lyme disease doesn't make you better. If it's not Lyme disease, then what is it? It's their responsibility to try and figure out what's making you so sick. So just briefly, I can talk about most people who get Lyme disease. The most common symptoms are things like intractable fatigue. They just get very, very tired. Almost all of them have pain, either headache, joint pain, other kinds of discomfort. The joint pain can be migratory, where your shoulder hurts one day, your knee hurts one day, those kinds of things. Many, many patients get what's called brain fog, where they have trouble with thinking clearly. They cannot do, they cannot remember things. They cannot make good decisions. They cannot think as clearly as they used to think. And they understand that something is very wrong with how they're thinking, but they don't understand why that is the case. Many Lyme patients initially become anxious. They can be irritable. They can have a lot of cognitive problems. Like I said, they can just not be able to add as well as they used to. They might have trouble finding the right word to fit into a sentence. Those are things that most people have in common when they have Lyme disease. Now, you can have all of those or none of those. Some people have what's called a bullseye or target lesion, but most people do not. Maybe 10–15% of the patients have a classic rash, target or bullseye. Maybe 20 or 40% of people have a solid red oval rash. But most patients have no rash at all. So lots of times on TV, they'll tell you, oh, you have to have a rash or you don't have Lyme disease. That is not the case. So all those things can be part of Lyme disease, but don't necessarily have to be.
So there's not
many people.
So there's
Yes,
not
go
a
ahead.
totally. There's not a. It's not a total picture, is what I believe Kathy Spreen is telling you. This is not like a one shoe fits all. One shoe looks like all. It is not a total picture. You've got to be tested. There can be a myriad of things. It could be this. It could look like this. You could have this, but you've got to be tested. And
But the testing is very unreliable.
right.
Even the CDC, who's the biggest proponent of the testing, admits that the testing in the two-tiered way that it's done, described on the CDC website, misses probably half the cases. Probably the best testing now for Lyme disease is a blood culture, and that's through Advanced Laboratory Services. They have a good blood culture that actually can grow the bacteria that causes Lyme disease. Routine cultures at your local hospital probably will not identify the Lyme bacteria because these are very, very finicky bugs. They have to have a certain media, a certain oxygen level, a certain temperature, a certain pressure. So if you're just smearing them on a plate in the lab at your local hospital, it's probably going to come back negative, and then the doctor's going to say, oh, you don't have Lyme disease.
What about,
Well,
and we only have like another minute, but I wanted to ask,
Okay.
and this is so much, we'll have to have you on again, but what about this Lyme vaccine? Is that something people should pay attention to?
Be very, very, very careful about the Lyme vaccine. The original vaccine several years ago, they took it off the market because they said it wasn't effective Well, that's true, but it also had very, very severe side effects. And some of the people that are sickest today with what looks to be long-term symptoms of Lyme disease are people who got that vaccine. Now, another vaccine is supposed to be coming out. I haven't heard much about it in the last couple of months, but it was supposed to come out this year. I would be very, very careful and make sure that that doesn't have the same problems as the original vaccine had.
It's kind of typical of vaccination sometimes. So tell everybody, Dr. Spreen, where they can find your book.
Okay, my book is called Compendium of Tick-Borne Disease, 1,000 Pearls. And there is a website that is tickpearls.com. And you can order the book on the website. If you order in association with the show, you can get it for half price, which is $60. If you order it from Amazon, unfortunately, it's $120.
So let me ask you a question really quickly. So if they order it from that website, they can have it for, you said 50%? What did you say, 50% off?
Yes, it's half price. And anytime when I interact directly with the people, either like through your show or giving lectures or whatever, our goal is to just get the book in as many hands as possible. We make very little money on it.
Right. So do they need to put a certain code in?
If you just click on that, and it would say it would be $75 if you click through the website, but if you note that it is through the show, then we will give it to them for the $60 price.
Thank you, Dr. Spreen. Thank you so much for being here and for sharing all of this. And I mean, it was
after I did your show previously, I got lots and lots of feedback and people coming back to me. So it was your show was a good vehicle to educate a lot of people.
Thank you. Oh, thank you for telling us that, because just like you, we just want to keep getting this information out. So thank you for saying that, and thank you everyone for being here. Connect if you have any questions at all. Write me, Marilyn Shannon, above my head. You can see the show notes; they'll be available for you very, very shortly. And we look forward to having Dr. Spreen on once again, because we want to be kept up with what's new, and we want you to know what's new, and so that we all can be better educated. So thank you very much, Dr. Spreen. I wish you well today, and everyone out here, thank you so much. And next week, I hope I tell you I have a new grandchild. Mwah.
Oh, that's exciting.
It is. Bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCVVI members, The Tanya Love Show, Reawaken Your Brilliance with Julie Seibert, and if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals. ThatVidBlasterGuy.com, CarolinaApparel.com, and DeltaForce.net.